This next segment, I will talk with you about examples of models of care. The first example, combined living. As you are aging and you are needing more assistance, people are combining their households. They're moving in with each other. There are designated rooms or maybe a designated wing where a person will live. And as a result of that, they're able to assist each other, and aging is much more of a palatable relationship. But then sometimes, this next example, people just want to age in their home. They want to stay in their home. They love the comfort of their home. Therefore, they stay in their home, but they may contract with home health care agencies or individuals who provide assistance. That assistance may range from helping a person with their bathing, and in the healthcare industry, sometimes we call it the activities of daily living. The person might need someone to come in and help cook their meals and prepare their meals and put them together. A person might need someone to help them go to the doctor's office or run errands. But again, that person really wants to stay in their home, and they don't want the grandchildren or their children around, but they want to have the opportunity to visit when they want to visit. They can have people over and continue to socialize as they always have. The next example is considered assisted living. In assisted living, it's a communal setting, and often, and a lot of times, it depends on the person's personality. Some people don't like to have a lot of people around, but then other people like to have activity in other people. Assisted living is a model where there are apartments. You may have 1 or 2 bedrooms, a living room or sitting area, but on site, there is someone there who can give you your medications, who can monitor your blood pressure, just to see how you're doing physically. And if there is a type of crisis, there's somebody right there on site that can provide assistance. It's not required 24 hours a day, but there is someone there just in case you need someone. But in addition, in assisted living, it is a communal setting where you have your neighbors. You're able to go to a community dining room if you choose to, or you can have meals in your home, but you have friends or people of the same age around you that you can socialize, but yet you're still pretty independent. The next example is a nursing home. In a nursing home, most of the time, a person has had to go into a hospital or their health has really declined, where on a 24-hour basis, that person needs some kind of medical monitoring. And in a nursing home means that in a 24-hour basis, you have a registered nurse who manages the care of all the patients in that building. And under that registered nurse has LPNs, which are licensed practical nurses, or other RNs on each shift. And in addition to the RN or LPNs, you have nursing assistants. So on a 24-hour basis, in a facility like this, you need medical attention that requires the level of care that's given by nurses. In addition, you may need assistance with physical therapy, speech therapy, and occupational therapy. And with all of that care, The ultimate person responsible for that medical care is the medical director. So it's important to know when you get to that point, your condition is such that you need a doctor that's monitoring your care under the direction of a registered nurse with complementary staff of nurses, nursing assistants. The next level of care, or the next example I'd like to share with you, is continuing care retirement community. In a continuing care retirement community, again, this is congregate living, but when a person moves into a continuing care retirement community, they're moving into the community as a well senior. Most requirements for continuing care retirement communities are that you have to be at least 55 years of old and you are not very sick. You're not medically compromised. So in a CCRC, a person may come into the community living in a home. It could be a 3-bedroom, a 4-bedroom, or 5-bedroom. You have your car. But when you move into a continuing care retirement community, the promise is that as your care or your care needs increase within that campus, that care will be provided and you will not have to move off the campus. So again, you've come in, you've moved into a home. Your health starts declining and you don't want to have a house. The next level within that continuing care retirement community is an apartment. And in that apartment, you still are able to go and drive your car and take care of your daily needs, but it's a smaller environment. But within a continuing care retirement community, in that apartment, if you need additional assistance, you can contract with people who have been screened within that community to provide that additional assistance. As your health declines and you don't need that larger apartment and you need more care within that community, then you move into the assisted living area within the continuing care retirement community. And there's staff there that help monitor your blood pressure, monitor some of your conditions, and they provide assistance as needed. And then as your care declines, you may have to go into the nursing home part within the continuing care retirement community. So the models of care again are you're combining your households, you're either desiring to live within your own house, you may like to have more of a communal setting where you just have an apartment and you live in an assisted living facility, or there's then the last model that is on one complete campus, the continuing care retirement community, which is a CCRC. I'd like to talk with you about the cost of the models of care. Combined living is the least expensive, and in combined living, what you're finding are families coming together. Sometimes a child may move into the household of their parents, or the parent or parents move into the household of their children, and they combine their resources. The amount of money brought in by Social Security or pensions, and then the income of the children, combining that household and helping each other out. On the other range, or the most expensive, is the continuing care retirement community. In the continuing care retirement community, you're moving into a community as a well senior, but you're paying an upfront fee, an entrance fee, and then you're paying a monthly fee to provide the care, the needs, and any service as a result living in that community. And you will find CCRCs, or continuing care retirement communities, in just about every state and just about every community within the United States. The entrance fee may range from $150,000 to $350,000 to enter the continuing care retirement community. I worked for communities such as the CCRC. But in addition to that entrance fee, based on the model of a home or apartment you choose, you will have a monthly fee of $5,000, $10,000, $15,000, or $20,000 a month. And based on the additional services that are needed, you will pay for those services. So if you want to have someone to walk your dog, or you want to have companions, or you want someone to drive you, you will pay an additional amount for those services. And those services may range from $20 to $25 an hour. So in a 24-hour period, that cost would include your entrance fee of $150,000 to $350,000, to your monthly fee of your home or apartment, $5,000 to $20,000. Then if you need assistance and you're hiring a companion, that cost could range from $5,000 to $20,000 a month. But within that continuing care retirement community, you're paying for all the services you need. And another example, let's say you have a pet, you don't have any children. That companion will pay for walking your dog or driving you to a restaurant. So the range is living at home and combining your households to paying and moving into a continuing care retirement community. And that's the range of how you choose in the model.